So I have the pleasure of interviewing my dear friend, Dr. Dan Engle. Thank you for coming to Vancouver, British Columbia to take time to actually just have a conversation. I'm speaking to you because you are an expert in this field, and I wanted to go into this, the whole idea of psychedelic or transformational coaching. Where can people approach this, and where can people find this, and how is this going to be available, and how do you make it available through your work?
Yeah, that's the exciting time we're in. Like, we get to co-create the new medical movement and the new medical paradigm.
So amazing.
And it's an exciting time to be in this conversation because it's accelerating and it's going to continue to accelerate, particularly as these medicines become legal in the therapeutic arena. But I realized that was going to be my path, and to bridge these plant spirit technologies and consciousness tools with modern day and contemporary psychiatry.
Wow.
And how do we bring these tools of consciousness into a framework that allows us to heal on each of those levels and to create a new sophisticated system of medicine that now is the birthing of what we see in transformational medicine.
The idea that it is not all physical, it is very mental and spiritual. In fact, very spiritual on many levels as far as the outcomes that people can achieve. I wanted to ask you, what is the current state of medicine? And then, the idea of how mental health plays out in this as well.
Yeah, it's a fascinating time to be in the witness perspective and the co-creation perspective of the new medical paradigm. Because we see this shift happening, and it's ripe to happen. Allopathic medicine has dominated the landscape in the last 100 years, often to the exclusion of the other systems and making oftentimes them wrong. Allopathic medicine has made chiropractic medicine, naturopathic medicine, Ayurvedic, Chinese medicine wrong at various stages. And not even 10, 15 years ago, acupuncture and Reiki, energy medicine, were thought to be like voodoo or woo-woo medicine practices. And now they're being used in the hospital settings and even being reimbursed through insurance models, which once you've done that, you've crossed over into like some degree of appreciation.
The government likes you.
Yeah, exactly. Now you've got like the seal of approval.
Yes.
And what we see happening is allopathic medicine, Western medicine, has now transitioned into functional medicine and integrative medicine, which is a huge step forward and evolution. And it's still fairly reductionistic. Functional medicine, integrative medicine still looks at the system as a means to orient healing through more natural methodologies. Energy medicine, herbal medicine, structural integration, digestive wellness, how the gut is the second brain. I mean, we can go on, and these are all better terminologies and doorways in, but yet we still haven't fully integrated this spirituality.
That's right.
At the level of deep mind, at the level of who we are at the core of our being. That now is the opportunity to move into transformational medicine. And transformational medicine is essentially the opportunity in the healing arena, in the clinical therapeutic arena, to have a sophisticated menu of options that people can be assessed by trained practitioners through diagnostic and assessment tools, to be available to go through a cultivated and stewarded facilitation of awakening, facilitation of transformation through all aspects of their being. And that doesn't have to happen with plant medicines, and it doesn't have to happen with psychedelic states or altered states of consciousness. And it just happens to be that those are some of the more sophisticated and effective and efficient and safe tools to use to help people wake up. There's a variety of different ways to wake up. And it's just been my experience that these medicine states and these medicine technologies are so good for healing the 5 primary psychiatric conditions that are now in epidemic proportion: depression, anxiety, PTSD, addiction, and pain. And when you look at the data for the medicines like MDMA, psychotherapy for chronic severe PTSD, post-traumatic stress disorder, psilocybin for treatment-resistant depression and addiction, ketamine for treatment-resistant depression and addiction, and even traumatic brain injury. And the list goes on. We could talk about the big 10 that I call them medicines that are being studied today. Those are just a few to name. The data is so compelling. So when I'm speaking to an audience and an arena of clinicians, especially allopathic physicians, I've learned a long time ago that the best service that I can provide is to give data first.
Yes.
As opposed to coming in as an evangelist and wanting everybody to jump on the train.
Sure.
It's not my job to sell anybody anything. It's my job to just give data. And we have, as physicians, taken an oath to be aware of the current data, to be able to recommend the best tools and agents on behalf of our clients, and leave our biases and our judgments and our prejudices aside to the best of our ability. So the data is so good, and when we look at the data and we understand it, it's amazing to see the conversion experience just that people in the audience will go through when they hear the data. Like, wow, why haven't I heard of these tools and technologies before? Why are these illegal and they don't meet criteria? Many of these medicines do not meet criteria for being in Schedule 1 or illegal, which means Schedule 1 is there's no known medical benefit and they're highly addictive. Most of these medicines fail on one, if not both accounts, because there's massive medical benefit, and most of these medicines are anti-addictive. They actually treat addiction, and you don't get seduced to keep going into the experience. They actually heal the core issues that are the trauma patterns at the level of deep subconscious experience, that now when those core issues get healed, the addictive patterns can get resolved, and we can welcome back those traumatized parts of ourselves into a more integrated whole. That's the difference between recreational use of psychedelics and therapeutic use.
This idea of it becoming more mainstream. So I look at, the MDMA, psilocybin, the ketamine treatments. I've seen studies on it. Can we talk about some of the statistics, and benefits? I'd like to talk about that.
Absolutely.
Yeah.
And your comment around why it's becoming more appreciated, why people are becoming more curious, is because the data is so good, and it's being presented in a way that people can digest more readily. The sophistication in the documentaries that are being offered. Michael Pollan's book, for example, How to Change Your Mind, was written by the perfect guy at the perfect time on the perfect subject. And within 2 weeks of it being published, it was on the AARP, American Association of Retired People's reader list of the books to read. That's the most conservative readership in the country. And I realized, holy cow, now we're really making gains because we're reaching the masses. And people are curious about this next wave of psychedelic research. Because psychedelic research was really strong in the 50s, 60s, and 70s, and the Nixon administration put it all into Schedule 1, and it went through this 30-year hiatus. And now it's gradually taking traction again. Again, being driven by the data, which is so good. So for example, we mentioned MAPS. MAPS is the Multidiscipline Association for Psychedelic Studies, MAPS.org. It's headed by a guy named Rick Doblin. He's been fighting the campaign for MDMA-supported psychotherapeutic legalization for 35 years. And it's in phase 3 trials, being green-lighted for therapeutic legalization in the next 12 to 18 months. It's actually going to get rolled out on a small scale in the next 6 months. Very small scale, and gradually more and more. So why is that? It's because the data is so good. And when you look at its data compared to the standard of care, it's several orders of magnitude better. So first of all, let's talk about the standard of care. The standard of care for complex chronic PTSD, post-traumatic stress disorder, is psychotherapy and psychopharmacology. The type of psychotherapy is cognitive behavioral therapy, usually. And the type of psychopharmacology is usually antidepressants, anti-anxieties, sometimes antipsychotics for sleep or off-label use, and hypnotics, things that put people to sleep. Those are the 4 classes of medications. Use those 4 classes of medications and psychotherapy, and your improvement rate in symptom benefit or lessening those severe symptoms of flashbacks, nightmares, hyperstartle response, reliving the trauma all the time, is maybe 30%, 30 to 35%, plus or minus, of symptoms improving. Now, when you look at MDMA-supported psychotherapy, 2 to 3 sessions with a trained provider who knows trauma recovery work really well, in the midst of MDMA supported psychotherapy, so it's like a 4 to 6 hour therapeutic session, the cure rate, not the improvement rate. And what I mean by cure rate is after 2 to 3 sessions, 68 to 83%. There's a couple of different studies depending on the numbers you look at.
Sure.
So let's call it 70 to 75% of people no longer meet the criteria for PTSD.
Wow.
Cured. That's not symptoms just getting better. That's no longer having symptoms to meet the diagnostic criteria. So you've just seen like the standard of care is maybe 35% of improvement. It depends on the therapies that are being used. Sometimes it's a little higher than that. Sometimes a little less than that. So let's call it 35 or maybe even round up and call it 40%. 40% in the standard of care of symptoms of people have symptoms improve. Versus in MDMA-supported psychotherapy, you have 70, 75% of people no longer even meet criteria. Several orders of magnitude better. And that's only in 2 to 3 sessions. That's no psychopharmacology or not having to go through psychotherapy for like years and years and years and years, which is the standard of care. Mm-hmm. So when you look at that data, it's so compelling. Wow, that's amazing. Tell me more. So you're working with a technology that works very different. It allows access to the core experience to be able to reweave it through a corrective process and integrate that aspect of ourself into a more whole human.
There's this other layer that I sort of learning and delving as I research this is the spiritual nature that you gain. I did a little bit of a documentary last year and looking at psychedelic medicines, just scratching the surface and learning more from you earlier this year and then delving more. But the spiritual nature of them opens up. I've noticed it in people. Can you tell me about that? Because that's a big one to me. And I think if more people went through this, maybe there might be a little bit more love in the world. And that's just not like a thing that I'm saying. I truly believe that.
Yeah, that is actually true. We come to, I say we because me going through hundreds and hundreds and hundreds of ceremonies myself and witnessing and supporting others through that process, we collectively come to a greater place of peace within ourselves,
yes,
appreciation for the interconnectivity of life, appreciation for you are another me, yes, seeing life through different eyes, but we come from the same point of creation. We are sharing this collective place we all call home. And so that whole process is an evolutionary cycle in it, and you can't help but be spiritually awoken, or at least matured through that process. Crisis precedes transformation. And if we know that it's purposeful, and that's where it really helps to have an outside support, a coach, a counselor, a therapist, a mentor, being able to put it into context. Like this is a part of your becoming the next phase of your life and the next level of maturity and growth. That the pain has meaning. And when pain has meaning, our suffering goes down. When we have more meaning in our life, we have less suffering. Pain's gonna happen in life. It happens like through childbirth, like day one. Suffering is fairly optional, depending on how we look at the situation. So when we go through a process of understanding that the medicines aren't here to fix us. And that's, I think, a big deception and a seduction into the medicine path or using these psychedelics. The medicines aren't designed to fix us. It's still our work to do. But what they do is something you were talking about before, which is show us truth. They show us the way to better orient our lives, the better choices to make, the relationships to heal and clean up, the addiction patterns that don't really serve. And that could be addiction to like social media just as much as drugs and alcohol or a variety of other behavioral conditions. They help us see the clarity of our truth. That's why one of my teachers calls them clarigens. As much as psychedelics are expanded states of consciousness, these tools are clarigens, and they help us see the clarity of our own truth, not just truth of somebody else's. These medicines help us orient towards truth, our own truth, or our authentic truth, and the appreciation that our truth is important. Mm-hmm. And every life is as important, yes, because we all come from the same aspects of creation.
Yes.
And when we have an aspect of medical tradition that appreciates body, mind, heart, and soul, healing, and evolution, then we can create a sophisticated framework to support people's healing and growth in each and all of those arenas.